everybody. So I am here. I'm so honored to be here with Dr. Neal Barnard, who is an adjunct professor of medicine at George Washington, I've got to get this right, University School of Medicine in Washington, D.C. And he is also the president of the Physicians Committee for Responsible Medicine and an author of how many books have you written?
Oh, this might be number 20, perhaps, something like that.
20. And I am here with, I apparently have the first hard copy, hot off the press. Like Dr. Barnard said, he hasn't even seen a hard copy yet of his brand new book, which is called Your Body in Balance. You can see I've already got all my little Post-it notes going. And Dr. Barnard, and for all of you watching, this is a book that I was just so excited to get it in my hands. It is music to my ears. You know, many of you ladies watching are, you know, on tenterhooks because you're bothered by all the hormonal issues that you go through. There are so many unanswered questions out there. There's so much misinformation. You know, the internet, obviously we go there to Dr. Google and all we get for the most part is misinformation. So thank you for being with us, Dr. Barnard, and setting the record straight with evidence-based science as it pertains to our hormones.
Well, thank you for including me in your program. I'm delighted to be with you today.
So what spurred you? Because I know you've written a lot of books. We've got books about, I love The Cheese Trap. If anybody hasn't read The Cheese Trap, that would be the next one to buy. But what spurred you to write a book specifically about hormones? And I know this is for men as well, but about hormones.
I was sitting here at my desk. The phone rang. This was years ago. The phone rang, and it was a young woman who said, Dr. Barnard, I need your help. I can't get out of bed. And I said, what do you mean? She said, I've got cramps that are so bad, I just can't function. She had a business trip the next day. She was supposed to get on a plane. She couldn't move. And she said, this happens to me every month, at least one day. It's just fistfuls of ibuprofen. I've got just terrible cramps that are really hurting me. And so I started thinking about what menstrual cramps are. And every month, under the influence of the hormone estrogen, the female sex hormone, there is a thickening of the inner lining of the uterus. And at the end of the month, that thickened lining disintegrates into menstrual flow. And as it does, cramps occur. And the cramps relate to prostaglandins. These are maladjusted chemicals that are in that thickened tissue. They come out, they hit your brain and make you feel rotten, and they hit the muscular wall of the uterus. They cause cramps. So in my mind, as she's describing her symptoms, I thought, okay, I can give you some painkillers, but what about next month? Maybe if there's a way that we can dial this estrogen down a little bit so that there's not so much thickening of the uterus, so there's not so much prostaglandins to make you miserable, maybe you'll feel better. So here's what I said. I said, let me give you some painkillers for 2 days, but would you like to try an experiment? She said, I'll try anything. And I, at that point, said something I don't think any doctor ever said to a patient, which was, I think your menstrual pain is going to change if we do 2 things. Take the animal products out of your diet completely. I'm going to make you a vegan. For some people, that's a completely new word. But what I'm trying to do is get away from animal fat, and I want every bite of food to have a lot of fiber, because we learned a long time ago that that combination will dial estrogen back into the healthy range. And I said, but I also want you to keep oils really low, so no more greasy fried stuff. She said, I don't know, I'll try this. The next month, she called me up and she said, you won't believe this. My period came with 0 symptoms, nothing. And the month after that, and the month after that, but if she would deviate from these guidelines, the pain would come back. So I thought, well, that's interesting. So I did a research study with Georgetown University's Department of OBGYN. And we found that this works not just for her, but for lots of women. And I got to tell you, in the course of this study, we asked all of the participants to not take any hormone medication, because that would goof up the study. And that included the birth control pill, because it's a hormone. And so we said, if you're sexually active, use some other kind of contraception. One of the women in that study said, don't worry about me. My husband and I gave up the idea of having a baby a long time ago. We've both been evaluated. It's not him, it's me. I don't ovulate, I'm infertile, that's it. We don't use any kind of contraception. So you don't need to tell me not to take the pill. The second month that she was on this healthy diet, she came into our center and she said, Dr. Barnard, I got bad news, I got good news. I said, what is it? The bad news is I have to drop out of your study. And the good news is she was pregnant and she gave birth to a healthy baby. And years later, I was giving a talk in a different city. I didn't know that she'd moved there. She came to my talk and she had 3 children. And did so many, anyway, what you were saying in the introduction, so many women and men too, they have so many symptoms, so many issues that they thought were part of their genetic makeup or bad luck, or this is what it's like to be a woman or whatever. I mean, maybe so. I mean, our bodies are fragile in many ways. However, what I started to discover is that we need a little bit of hormones for good health, but they can get into what I call hormone haywire, where estrogens or thyroid hormone or insulin or other hormones are just not dialed in the right direction. And the way to get them right back is food. So forgive me for that long-winded answer to a very good question, but that's what got me going in this direction. And we discovered it's just menstrual pain, dysmenorrhea, endometriosis, infertility. All of these things can be changed, surprisingly, by relatively simple diet changes.
Wow. I mean, that's what really blew me away about this book, your new book, Your Body in Balance, because, you know, I, as a nutritionist, I understand that what we eat for 3 meals a day can significantly change our health outcome and lower our risk for disease. And that's what excites me so much. But when it's related so specifically to hormones, and as you've just said, and for those of you, you know, women who are watching and men, you know, in this book, Dr. Barnard covers everything from prostate health, if you're a guy, or for your husband or whatever. But really, for me, it's interesting. I have a teenage daughter. So for your daughters, for your grandchildren, for you yourself, for when you're getting older, what I think is so wonderful about this book is that you cover every chapter of a woman's life. So whether you're dealing with premenstrual cramps, whether you're dealing with perimenopause, menopause, etc., sort of everything is spoken to. So it's such a valuable book in that respect. And I think it's a beautiful gift to give to any woman. Certainly, I'm going to have my 18-year-old daughter read it because for many reasons, she's vegetarian, but she's not vegan yet. And that's the missing link. I know that, you know that. And she still suffers from these terrible menstrual cramps. And I'm sure it's because she's eating cheese. You know, one of the things that I found to be so interesting and powerful that you spoke about is this combo, this sort of winning combination of adding fiber and the studies that you've got. I wrote some of them down. It's like an extra certain percentage of fiber in our diet. Women who consume 30 grams of fiber a day are 32% less likely to develop cancer, breast cancer. So what I found interesting was this combination, there's so much here, of increasing fiber significantly and lowering fat in the diet. Can you speak to that as it relates to preventing disease prevention, cancer prevention, and particularly women who are postmenopausal?
Exactly. Researchers have been studying these things in isolation, and we can now put them together. Fiber is kind of a boring word, so I'm hoping people don't go to sleep when we talk about fiber. It really just means vegetables and fruits and beans and whole grains. So that bean burrito has fiber, whereas the chicken taco or something really doesn't. So it's healthy foods. But what fiber does, your liver every day is filtering your blood. And as it does, it pulls out excess estrogen molecules and it sends them down through the bile duct into the intestinal tract. And that's where fiber works. In your intestinal tract, fiber picks up those excess estrogens and carries them out with the waste. You're literally flushing away unwanted excess estrogens that can cause problems. So the fiber in vegetables and fruits and beans helps you. But what if your lunch was, say, a salmon fillet or chicken breast? Well, it's not a plant, so it doesn't have any fiber at all. And so your liver still pulls those estrogen molecules out of your blood, but when they get to the intestinal tract, if there's no fiber there, those estrogen molecules are reabsorbed back into the bloodstream. And so your estrogen level is a little too high, and it's hitting your uterus, causing the expansion of the endometrial layer. It's hitting the breast cells, increasing the risk of breast cancer. So I know it sounds so easy to eat vegetables and eat fruits and eat beans instead of the meat or the cheese or something like that. It sounds easy, it sounds too simple, but it's very, very powerful. Now with fat, it's a whole separate thing. If a person goes vegan but eats a lot of grease, what we find is that that grease will cause their menstrual pain to act up also. So it's important also to keep that low. So when we did the recipes, and you'll see in the back of this book,
there's so many recipes. There's a meal plan and tons of recipes. It's amazing. It's fantastic.
They were done by Lindsay S. Nixon, who many people know as a wonderful recipe creator and a real vigorous advocate for healthy eating. But the whole idea was to make sure that we have foods that aren't using a lot of grease, that are really quick and easy to make. All the taste, but none of the regrets. And let me tell you a funny story, if you don't mind. When Lindsay and I started working together, my part is the science and how to make it work, and here's step-by-step ways of doing it. But Lindsay gave me the recipes to make it work. So she gave me this set of, I think it's 65 recipes, and they're great, and we were testing them, but she sent a note along with it. And the note said, I didn't tell you this before, but I had such terrible cramps before. And then she had been using this same approach and found that it made life livable for her. So I've discovered that with so many people where they found that their body was out of balance. And by following this healthy diet, so many things can get better. And it's not just pain, it's not just fertility, but it's just energy and how you feel from day to day, and how your skin looks, and your hair, and all these things change depending on what we're eating.
Oh, I mean, I'm just obviously completely on the same page as you. And I think the thing that really I've seen move the needle, which is why I find it so interesting, all the science in this book, is there's vegan diet, as you point out, and then there's a high fat, oily vegan diet. And I've seen or found, my experiences, that a lot of the books out there and all of the recipe books, all very well meaning of vegan recipes, have a lot of oil and fat in them. And so really, truly, to move that needles in terms, as you point out in the book, for weight loss, as well as, the health aspect, it's vitally important to get that. Oil is not healthy, right, Dr. Barnard? It's just not. I mean, I know you talk so much about this and have done in the past, and how that relates to reversing diabetes as well. Could you just touch on that briefly? Because I think people are so obsessed with this insulin resistance coming from getting rid of all the sugars and the carbs and this kind of crazy keto nonsense. But can you just speak to that a little bit? I know I'm throwing a lot at you here.
Oh, no, I'm glad you raised that, because what you said is exactly right, that people who have pre-diabetes, or their blood sugars coming up a bit and their doctor's concerned, and eventually they get diabetes, they often imagine that this was caused by sugar, or I ate too much bread, too much carbs, and that's what caused it. That's not true. That's not what it is. Now, you can understand why a person would think that, because they've got a high blood sugar, so they will figure it came from eating sugar, and when they eat sugar, their blood sugar does rise. But the cause of this starts way before that. What happened is, you're eating fatty foods, a cheese sandwich, and the cheese gets, the fat molecules get into your blood, and they arrive at the muscle cells, and little fat particles start building up in the muscles and in the liver cells. And as fat builds up more and more and more, it stops insulin from working. What I mean by that is, insulin is the hormone that acts like a key to help sugar get out of the blood into the cells. And that insulin key works fine as long as that muscle cell or liver cell doesn't have too much fat building up inside. But if we've been eating our bologna sandwiches and our burgers and our chicken nuggets, the fat builds up in the cell and the insulin can't work anymore. And so at that point, the sugar just keeps building up in the blood. And people think, well, if I eat sugar, it builds up even more. That's true. But the answer is clean out the cells. So back in 2003, my research team was funded by the US government to test a diet that does exactly that. There was no animal fat in the diet. It was a completely plant-based diet. We kept oils really low. and we found a miraculous thing that you could start removing fat from the cells. Insulin could start working again. It's like you're young again. And we started seeing what we had never seen before, which was insulin going away. I'm sorry, diabetes for some people going away. And up until that point, people thought diabetes was irreversible. Now we've discovered something really quite different. So that insulin hormone can get back in balance too.
So really, on the sort of ketogenic diet sort of mentality, you're actually just removing the symptom, not the cause. So just by taking the sugar away, well, yeah, your sugar levels are going to drop, but you're not dealing with the cause. That's what I hear you saying. Is that correct?
That's really right. Now, if a person, I think ketogenic diets are a big mistake, because over the short run, if a person follows a ketogenic diet, and sometimes when you take all of the sugar out of your diet and all the carbohydrates, your body gets into sort of a desperation mode, and it makes compounds called ketones that can kill the appetite in a way. And so sometimes people start eating less and then they'll lose weight. And if they lose weight, there are certain benefits. Weight loss will occur. For some people, their cholesterols go down. However, because of the foods that you're replacing it with, they're eating meat or gravy or cheese or these kinds of things, sometimes their cholesterol levels don't go down, they go up. Over time, what we often see is people, that initial weight loss is not sustained. And over time, they get worse and worse and worse. But the heart disease and overall mortality on these diets is substantially worse.
Yeah.
And there are lots and lots of ways to lose weight. And by far, the healthiest way to lose weight is to build your diet from Mother Nature's favorite foods.
Yeah.
Fruits and vegetables and whole grains and beans and all the wonderful things that they can turn into.
Absolutely. You know, and I love that the Christy Funk, who, for those of you who don't know who she is, she's, you know, a breast cancer surgeon and co-founder of the Pink Lotus Breast Center, and has done an awful lot of work, particularly recently in the field of educating people about breast cancer prevention or recurrence if you have been diagnosed with breast cancer. And she actually writes a big blurb on the back of this book and talks so much about that. So this is so heartening, I think, for women who have this disease that they dread so much, that actually is a solution. And there's a prescription both from you and from Dr. Christy Funk, who, you know, are on the same page. I also think it's so interesting that in your book, you say, you know, that 6 ounces, a 6-ounce serving of chicken, of a chicken breast, and a 6-ounce serving of salmon contain, both of them, 30 grams, right, of fat, correct? Right? And we don't think of those are sort of thought of as diet foods. And to me, it's just so interesting that it's, when it becomes so important to get this extra oil and fat out of our diet, that the very thing is kind of the old school way of thinking that those are the diet foods that we should eat, but they're not anymore. I mean, chicken is so full of saturated fat now, correct?
You're right. And we see the people who suffer the most, I have to say, are people who are trying to be healthy and they're following advice that they heard someone said, have some salmon. It's a fatty fish, and the fatty fish has the omega-3s that are good for you. And as time goes on, they really struggle. They find they're having a lot of trouble losing weight. Yeah. And what they find is as soon as they leave the fish out, they get the animal products out and they keep the oils low, then that weight loss starts coming back. But there's more to it as well. One of the side effects in quotes that we have seen from men is kind of a surprise. We've been doing studies on diabetes in men, and they come in and they might be 45, 50, 55 years old or more, and they've got a lot of weight, they've got diabetes, they got high blood pressure, their cholesterol is high, and many of them have erectile dysfunction. And in the course of switching to a healthy diet, they start losing weight and their blood sugars get better. But I cannot tell you how many of these men say, Dr. Barnard, I was not expecting a big surprise that I had this morning. Anyway, forgive me for putting it that way. But,
I mean, the movie, The Game Changers.
Yeah, Game Changers.
That.
And what a great movie that is. They found exactly the same phenomenon. And so for people who don't know what we're talking about, when you are on a diet that doesn't have any cholesterol in it and doesn't have any saturated or almost no saturated fat in it, zero animal fat, typically the arteries start opening up again. And that includes the arteries to a man's private parts. And so this blood flow that has been slowed down before all comes back. And I had a musician who was in one of our our studies, and he found that his fingers no longer hurt because he had diabetes, and his diabetes was getting better. His fingers didn't hurt anymore because the neuropathy was getting better. But he came into our group and he said, "I'm young again." So, anyway, I'm not quite sure how his wife felt about it, but he was feeling better.
I love that. And you know, that's what I loved so much about it's the movie, for those of you who don't know, it's called The Game Changers, and they follow athletes and you know, literally top premier athletes, and have them switch to a plant-based diet. And it's extraordinary because I think, if I'm correct, Dr. Barnard, it's the inflammation that is dramatically lowered, and then that increases their recovery time. It basically improves almost everything for them. So it's pretty powerful stuff.
Yes, yeah, it is amazing. In fact, that's kind of the latest thing that's been going on. My colleagues and I published a scientific article, a year or more ago, about how athletes would benefit from plant-based diets, and we are seeing this not just with the endurance athletes, but also the strength athletes. People in football, they discovered you want to be big, but you want to be muscular, not flabby, and plant-based diet is the way to get there. So anyway, that's been a big surprise too. So my message is for guys. You know, although I focus a lot on women's health, there are a lot of guys who really benefit from a healthier heart, to a trimmer waistline, to having their erectile dysfunction become just a distant memory. They can be helped in many ways.
So listen up, ladies. You know what? The really exciting thing is that by following this diet, you know, a plant-based diet that is very low in oil and extremely low in sugar as well, or lower in sugar, but let's dial down the fat first, is going to improve pretty much everything as you get older. And, you know, Dr. Barnard, I'm 55 years old, and I've been following this way of eating for about 7 to 8 years now. Never felt better in my life. Symptoms of menopause have been absolutely minimal, never been slimmer, and it's relatively effortless. You know, inflammation markers in my blood are as pristine as they could possibly be. And I 100% put this down to the education that I've received from doctors like yourself, who I really trust, who actually do, you know, the evidence-based science and present it to us in these bite-sized chunks that are so digestible, excuse the pun. Now, I know our time is limited, so I've got a couple more things I want to cover with you.
Yeah.
So for us ladies who menopause and beyond, one of the fears of menopause is, you know, the hot flashes, the extra weight. What am I going to turn into? I'm on this particular section right now, and you keep it really simple for us. And you say, you talk about hot flashes, but the two things that you say, keeping it so simple, are you go, trim away extra fat. That's number one. And number two, favor soy products. Now, number one, we've just talked about, and ladies and gents and anyone who's watching, the surest, quickest way to trim away excess fat is to go on a whole food, plant-based diet that is very low in oil. It's simple, make it effortless for yourself. And also Dr. Barnard, I don't call it a diet, I call it a live it, because I think once you get used to that way of eating, it becomes a lifestyle. And suddenly you're not doing rapid weight loss and putting every pound back on that you lost. On the contrary, it just stays. So triple, quadruple thumbs up for that. Please talk to me about favor the soy products, because this is something else that I see so much misinformation on the internet about, and people get worried about it. And you speak so much about soy in this book.
Yeah, the science is in. Where the urban myth came from was back in the 1930s, soy products were found to have isoflavones that actually can attach to estrogen receptors. So people started to worry, could they cause breast cancer? Or for men, could they cause man boobs? I mean, ridiculous, but you know what I'm talking about.
Yes.
However, we've had more than enough time to study this. And the first thing is regarding man boobs. If you wanted to, you could just go to the beach on a hot August day and look at one of the heavyset guys who's taken his shirt off and he's got a little bit of breast enhancement. Ask him, how much tofu have you been eating this past week? and may I say, he's going to tell you, I don't eat that stuff at all. What happened in his body was that as he gained weight from eating cheese and meat and all these things, his body fat is producing estrogens that's causing the breast development. It has nothing to do with soy whatsoever. But soy does not cause breast cancer. It does the opposite. Researchers have tracked this And women who consume the most soy milk or tofu or other soy products have about 30% less risk of getting breast cancer. And in women who have had breast cancer in the past, those who consume the most soy have about a 30% lower risk of dying of that disease. The women who avoid soy don't get any benefit at all. And so we encourage people to include soy products in their diet. It can be organic, it's not GMO, and you'll find ways of including it. And when women have had hot flashes, what they discover, not everybody benefits, but quite often women do find that it helps. And some women will say, I really want to ramp it up, and they'll use like an isolated soy protein powder. It's fine to do that. Experiment with it, see what works for you. There's no danger to it, no harm to it.
Is there too much soy that you can eat per day?
No, I don't think so. Now, we should keep everything in balance. You want to have vegetables and fruits and whole grains and beans. And soy can be, it's a totally optional thing, but it can be a very healthy part, and it's always healthier than what it replaces. But what I'm coming to is that some people have imagined that if they eat soy, it's stepping on the gas pedal and creating a higher risk of developing cancer. Soy products, as far as cancer concerned, are pushing on the brake. There's more than one kind of estrogen receptor in your body, alpha receptors and beta receptors. Soy attaches to the beta receptor, which we didn't know about back some decades ago. So the world has changed, and we now understand that it's a healthy thing.
I'm so glad we understand, because drinking organic soy milk and eating soy products basically completely diminished my hot flashes. They were non-existent. So it worked really, really well for me. Okay, we've got just a couple of moments left. You also talk about the antidepressant effects of fruits and vegetables and the mood boosting effect of a plant-based diet. Can you briefly touch on that? Because I know that is relevant for sort of everybody, whether you're in menopause or not. A lot of teens are now suffering from chronic depression.
We discovered this completely by accident. I was working with Geico, the car insurance company, because if you could look out my window over there, it's about 4 blocks away. And years ago, we were working with them in an employee health program using a plant-based diet for diabetes and weight problems. But in the course of this, we discovered that depression was lifting, and not just depression, but anxiety. And so we started looking at it in a very careful paper and pencil test way to rate these symptoms, and it was true. So we didn't know why, but we also then looked at job absenteeism, and that was getting better. So something was happening where people were feeling better. And of course, the employers were thrilled. But then other researchers have put this to the test in other ways and found it really quite consistently, that diets that are high in meat, like a ketogenic diet, are associated with worse moods. Diets that are lower in meat or no meat and high in vegetables and fruits are associated with better moods. Is that because you don't have so much pain, you don't have so much inflammation? Maybe. We're not entirely sure, but I suspect it's 2 things. There's less inflammation, which can affect the brain, and that makes you feel better, but the gut microbiome is improved. So the bacteria in your gut are the friendlier ones. They are not producing the compounds that make you feel crummy. So give it a try and see if it works for you.
Wow. Oh my gosh. I have to ask you one super quick addendum question, because I know so many people are going to ask you this. So I'm asking for that. With the soy, I get so many questions from women saying, what if I have thyroid, low firing thyroid, hypothyroidism, whatever? And they're freaked out about the soy products that I recommend that they eat because of that.
Yeah. Soy products do not appear to cause hypothyroidism, and they don't contribute to hyperthyroidism. What does, by the way, vegan diets are associated with the lowest risk of both hypo and hyperthyroidism in population studies. The people who do the worst are meat eaters, and cheese eaters do particularly badly. We think that's because those foods contribute to an autoimmune attack on the thyroid gland that makes it go a little bit haywire. With soy, there is one caveat I have, which is that if you are on soy medication, if you're on thyroid medication,
Yes.
Thyroid replacement, like Synthroid or something else, don't take it with soy or any food. Take it on an empty stomach, because food products are going to reduce the absorption of it, and your medication is not going to work very well. But it doesn't matter if it's soy or anything. You should really not be eating food while you take that medication.
Right.
Let the medication go in your stomach, and then have your meal later on.
Great. So basically, you are okay. If you have hypothyroidism, ladies, or any kind of thyroid issues, you are absolutely fine having your soy products.
Oh.
And that's it. Maybe some sea veggies, right, just to boost up the iodine a little bit, or iodized table salt. I think you say that talk about that in the book. Now, Ladies and gentlemen, this is the book. It is called Your Body in Balance, the new science, yay, of food, hormones, and health. Please do yourself, give yourself a gift, because this book is a gift. It really speaks to everything that I'm passionate about. We have the doctor actually sitting here with us. And honestly, there is so much information that you're going to want to read about to see the science. And there's a meal plan. There are delicious recipes. It is a must-have. Buy it for yourself. Buy it for your mother, your daughter. Certainly my daughter is getting a copy of this. And also, this is going to help the guys in your life, your husband, your boyfriend. It is such a great, great book. And so I thank you for writing it, and thank you for the incredible work you do. And I want to just pin this interview with one final thing, because you also do a lot of work, or your organization does. You're passionate about reducing suffering and cruelty for animals, correct? And animal testing. And
that's right.
I really applaud that work, because my community and I myself we are passionate animal lovers. Can you please tell my community where they might be able to go to find out more about where they can help you to do this very, very important work that you're doing to stop this unnecessary suffering for animals?
Well, first of all, thank you for mentioning that and for having such a wonderful heart. As we're trying to make science more relevant and more ethical, that means helping human health, but advancing it not with testing things on dogs or cats or other animals, but testing things with more modern methods that don't take a toll like that. When I was in medical school, my class was required to experiment on dogs and kill them in the course of an experiment, and I refused to do it. I said, I'm not going to have anything to do with that. Frankly, I can learn this without hurting anybody. And that's been my philosophy ever since, is that we can advance science and advance medicine without causing anybody any suffering. And that's what we're doing. So at our website, pcrm.org, you'll see more on all of these issues, and you'll also see Your Body in Balance there as well.
Beautiful. And I will put a link to that underneath this video in the description, so you can get going right away. Take action, buy the book. I'll put a live link in, and know how to take action to join this cause of stopping this unnecessary suffering for animals. You are absolutely wonderful. It's been an honor and an absolute pleasure to speak to you. Thank you for taking the time, because I know you're so busy doing so many wonderful things to make the world and us healthier, our bodies better, and to prevent disease, and have us feeling lean and gorgeous, men and women, as we get older. So thank you so, so much. And we will have you back. I'll twist your arm to get you back again, but thank you.
Well, I want to thank you, because a doctor can only see so many patients in the course of the day, but you reach so many people. You educate them, you inspire them, you would make them see what is possible. You will never know how many lives you've touched, how many people you've saved, but I appreciate everything that you have done, and it's been an honor for me to be able to share this time with you.
Thank you. I'll catch you next time.
Thank you.
Bye-bye.
I know.